prevention is always better than cure.
I know preventive health checkups are so important. There are so many diseases which can be detected early, which can be prevented by checking them early, diagnosing them early.
People even don't know at what age they should start doing their first health check. Most of the people think, oh, I am 40, now I should go for the health check. But you know, the first health check should be done at the age of 18 years.
Correct.
Yeah, and in case of strong family history, we recommend the first health check at the age of 5 years.
Blood pressure, diabetes, these are the diseases which can be easily diagnosed if their preventive health checkup is done on time.
Exactly, because blood pressure, as we all know, that it's a silent killer. 50% heart attack and 70% paralysis are because of blood pressure. After diabetes, blood pressure is the second leading cause of kidney failure. And in 85% of the cases, when their blood pressure shoots, they don't have any symptoms. They end up with heart attack or paralysis, and then they realize that their blood pressure has rose up to 200. And unfortunately, most of the people don't consider blood pressure a disease. Most of the people don't know how frequently they should check their blood pressure. You know, even children, they should also check their blood pressure at least once a year. And for adults, they should be checking their BP at least once a month.
Nowadays, people are indulging in so many bad habits like excessive alcohol consumption, outside food, late night snacks. All this is resulting into obesity and ultimately leading into diabetes and pre-diabetes also. Pre-diabetes, you need to do glycosylated hemoglobin.
So most of the people think that simply doing HbA1c will be able to diagnose their pre-diabetes, but you can be more proactive before you develop a pre-diabetes. Nowadays, if you look at the scenario, most of the youngsters are having fatty liver, and fatty liver is a sign of insulin resistance. So after you develop fatty liver, you get 10 years to prevent pre-diabetes. And after you develop pre-diabetes, you get another 5 years to prevent diabetes. To be precise, yeah, they should start checking even when they are 18 years old.
Yes.
So that is going to help them diagnose the disease in early stage and prevent the disease.
People tend to ignore the bone health and till it becomes very serious, they have some fracture, then only they prefer to undergo any investigations. There is a misconception that they should do the DEXA scan after 60s or 70s, but actually it should be done at the age of 50.
Most of the male think that calcium is for females only.
Yes,
so they don't realize that like females, they also have menopause. We call it andropause. And in female, the period stops. In male, the prostate starts enlarging. So like females, male also have to take calcium supplement after 50 years of age.
So there is pap smear, which is for cervical cancer, mammography for breast cancer, and there is a blood test called prostate specific antigen, that is PSA, which is done for screening of prostate cancer. Generally, we start at the age of 40 and go up to maybe 70, 75, and if possible, if suppose there is a strong family history or anything, we do continue later on also, depending on the patients. But it should be started at the age of 40.
Yeah, and so this is mammography, yeah.
Yes, mammography should be done yearly, earlier, and then maybe after 55 we can decide whether it is yearly or once in 2 years.
Because cervical cancer is the preventable cause of death in females worldwide. So they should get at the age of 21 years, and they keep repeating as per the advice by the gynecologist, and they continue doing it. So most of the people, not aware about this.
We have seen so many patients who have done no pap smear till the age of 65.
Yes.
So at the age of 65, we ask them to do at least one pap smear and then we close it.
Yeah, that's true.